tax reform that will come in February in the budget, education funding, which will come in February, carrying out our plan on the Turnpike, and continuing forward with job training and higher ed reform. So that's a lot, and but we're going to keep going. We're going to keep implementing. I mentioned the reform of regulations, and would now like to turn this over to Lieutenant Governor for some comments about the regulatory initiatives that have helped businesses be more successful. Mary?
Thanks, Governor. Before I start on that, I was just thinking, as you mentioned, the third grade guarantee. I know that you know I have two sons that are 21 and 18, and when they were little, I remember telling them, you have to learn to read before you can do anything else. And they struggled, and they were challenged by reading, but I really appreciate your efforts there and the efforts of the leadership in the legislature. It's an important issue, and I'm speaking now as a mom and as a parent, more so than just as the Lieutenant Governor. So I thought I would restrict my comments solely to our Common Sense Initiative. Certainly many good things have gone on in Ohio across state government, but one of the things that I have been leading and am very pleased at the outcome of our work and look very much forward to our continued efforts over the next 2 years, again, is our work through CSI. From my perspective, through CSI, 2012 has been a watershed year in how state government operates. For the first time in Ohio, state government agencies have to follow a formal process to propose and implement new rules that impact businesses here in Ohio. CSI successfully established this transformative process effective January 1, 2012. You'll recall Governor Kasich signed the first executive order organizing CSI, Senate Bill 2, a bill that worked its way through the legislature with bipartisan support, put the framework in place for our Common Sense Initiative, and then our new transformative process took effect January 1, 2012. So as of December 17th this year, CSI has reviewed more than 1,300 rules, and overall, as of the end of November 2012, rule filings are down by 43% over the historical average. We're certainly pleased with this positive trend, and I'm also, most important, pleased with the more deliberative process that ultimately will ensure that we have regulations that, number one, make sense, number two, that protect the environment and health and safety of Ohioans, and number three, do that without adding additional burdens or costs to our business here in Ohio. We believe that our message has been delivered loud and clear, and it starts with Governor Kasich, and that is before any agency proposes a new rule that impacts business, they have to bring all of the stakeholders to the table. They have to listen to what the stakeholders say, and they have to ultimately ensure that any new rule that's proposed can be justified through our CSI process. So we're pleased with the progress we've made so far and certainly look forward to the next 2 years. I thought I would share just two examples, and these are just two examples that speak, I guess, more specifically about the broad reach of CSI. One of the first items that we worked on from a rule perspective was the Ohio Residential Building Code. These were rules that had been proposed under the prior administration that were still working their way through the Department of Commerce. The rules were controversial. The stakeholders were not all on the same page, and in fact often wouldn't even sit at the same table. So we brought the Department of Commerce together, their staff, the Ohio Home Builders Association, and we were able to work through our CSI process and rewrite the residential building code in a way that didn't increase the cost for a new home for families looking to construct a new home. But also, if you look at the changes that were made during that process, just on the energy portion alone of the building code, upgrading and improving energy efficiency technologies throughout new homes, but doing it in a way that makes sense from a cost perspective. Our CSI process reduced the cost of a new home by nearly $2,000 compared to what was originally proposed in the originally proposed version of that code. So that's one example of where we put all the stakeholders at a table to work on an issue that had been under much consideration and debate for some time. The other item that I'd like to mention, and this I think kind of hits every aspect of what I think Ohio is good at. Academics, we're good at research, we're good at new technology, and we're also now able to bring to Ohio to stay on a more permanent basis, world-class, internationally trained medical researchers because of work that we did with the legislature to put in place processes where the medical board could license these physicians that come to Ohio originally on a temporary basis, again, coming as internationally trained professionals, but may want to stay in Ohio to continue their great work here. We now have a process in place where the medical board can ensure that we are protecting Ohioans and Ohio patients, but we're also allowing them to stay here to continue their great medically breaking technology research that happens here in Ohio. Ohio is a great place from a medical perspective. We have the medical corridor. We have so many advantages and opportunities from a medical perspective. This just adds to all of the other advantages that Ohio brings. Let me give you two examples of where this is important. We heard from a physician at the Cleveland Clinic who said, I came to Ohio 3 years ago under this temporary license. I'm now being forced to leave because my license is expired and I cannot renew it under the current statute. So we worked with this physician at the Cleveland Clinic, which ultimately is how this language came to us, and it's the Clinical Research Faculty Certificate. And then we ultimately learned that there was another group of physicians at the Cleveland Clinic who were dedicated to improving the outcomes in anesthesia. They were able to stay at the clinic and remain intact because of this new legislation where, had this not passed, several of their key staff would have had to leave Ohio because they couldn't renew their license. Another example, most recently announced, and I'm sure you may have read it, Nationwide Children's Hospital has attracted a world-class pediatric heart surgeon here in Columbus to bring his cutting-edge surgery and research to Ohio, not only to save Ohio's children through these new technological procedures, but also these physicians bring with them oftentimes jobs, investments in our communities, and grant dollars because of the type of research that they're doing. So from a CSI perspective, those are two examples of how we can reach out and help the business community and help stakeholders who are interested in making sure that Ohio continues to be a great place to create jobs.